very good morning to everybody. I'm Dr. Richard Vivedi from zenonco.io and Love Heals Cancer. Today's session is about creating awareness around cancer. Let me first introduce you to zenonco.io and Love Heals Cancer. We guide cancer patients in their journey with cancer. We aim to improve the quality of life of cancer patients through an integrative oncology approach that includes both medical and complementary treatments. We provide end to end care to cancer patients and help in their counseling sessions, medical cannabis, anti cancer diet, pain, and palliative care. For today's session, we're joined by Dr. Kartikeya Jain. Hello, sir. Very good morning. Thank you for joining us today.
Good morning. Good morning, Richard.
Let me take this opportunity to brief you about Dr. Kartikeya. He is a practicing medical oncologist in Vadodara. He completed his MBBS from SP Medical College, Bikaner. He later pursued his MD Medicine from St. Stephen's Medical College, Delhi, and went on to complete his DNB Medical Oncology from Bhagwan Mahavir Medical Hospital and Research Center. He deals with all types of solid cancers, blood cancers, and pediatric cancers. He has an experience of more than a decade in medical oncology. So, once again, sir, thank you for joining us for today's session. Is there anything you would like to say before we begin with the Q&A?
Cancer is curable. I would like to say one thing. Cancer is curable, and we should look for it. We should look for the symptoms of cancer, and the patient should contact to the doctor as soon as possible. And cancer is curable, and it is reachable. The treatment is reachable, and we have various patient assistance programs. So patients should avail that, and they should take the care at the proper time. And they should prevent cancer before that, they should avoid tobacco in any form, in form of cigarettes or pan masala, etc. Or they should also have good eating habits, like proper food, less junk food, as well as more fruits and vegetables, and a lot of water, and proper exercise. So proper food should be there, and prevention is better than cure. That's what one thing I want to say.
Right. So I think that was a very good motivation to begin with our session. So, sir, let's begin with the basics first. Can you help us understand what is cancer and what are the different types of cancers?
Yeah, cancer is a disease in which, due to various mutations and genetic changes, there is the uncontrolled division of cells in the body. So, due to this uncontrolled division, the cells keep on multiplying, increasing in number, and finally they take a form in a form of a swelling. They present, or they get these cells, tumor cells, they get disseminated throughout the body. So just forming this tumor swellings, as well as spreading to all of the body, they manifest in the body, like by forming a tumor, they obstruct the working of other organs, as well as by spreading to all the organs. They like the other organs are not able to work properly. As well as in the cases of blood cancer, yeah, usually it happens in the blood, or it may be in the bone marrow, or in the lymphatic system. So in these organs, there is uncontrolled division of cells. So finally they obstruct the working of the proper blood, the proper WBCs and hemoglobin and platelets, so that finally they cause more infections, more bleeding, and decreased hemoglobin in the form of anemia. So in blood cancers, these are the manifestations due to these uncontrolled division, as well as the solid tumors due to the hampering of the working of other organs. They cause this morbidity. So usually the cancer is uncontrolled division due to some genetic or mutational changes.
Right.
And if we talk about the type of cancers, like types of cancers, usually there are two main type of cancers. One is the solid cancers, and second is the liquid cancers. Solid cancers are usually like head and neck cancer, breast cancer, or liver cancer, kidney cancer. The liquid cancers are mainly the blood cancers. The blood cancers includes they are leukemias, lymphomas, or maybe multiple myeloma, or maybe like in rare cases myelodysplastic syndromes and myeloproliferative neoplasms. So usually these are the category of cancers in which broadly they are divided.
All right. I think that was very well explained. Now, sir, can you help us understand what are the common risk factors that can lead to cancer?
Yeah, risk factors. Firstly, we should keep in mind that cancer is not caused by any injury. It is not caused it is not spread from one person to another. We should keep in mind these things, these two things. Usually, the risk factors are divided into two types. Like one are the modifiable factors, and second is the non-modifiable factors. So modifiable factors, they include the most common is tobacco, which is very much rampant in our society. Tobacco may be taken in any form, in the form of cigarettes, cigar, bidi, or jarda in the form of a lot of names are there like mawa, paditi in Gujarati we say like that. So then other alcohol is there. Alcohol is also a major risk factor. So tobacco and alcohol, they are both synergistic. It has been seen that is a WHO report. It has been seen that per day 19,000 tobacco related diseases are caused in India, and this cause a lot of many cancers are caused by the intake of tobacco, like head and we start from head and neck, then esophagus, lung, stomach, kidney, blood cancers. So a lot of cancers they can happen due to this. And tobacco usually causes addiction, like it's habit forming. Usually the person keeps on taking that, and then finally there is nicotine in there, so there is an addiction caused to that. An addiction cause the continuous intake of the tobacco. So that is a major factor of destroying the family as well as the wealth and all the property. So we should prevent this tobacco. We should not take tobacco in our lives, and we should definitely avoid that. If we are taking alcohol also, then limited amount of alcohol should be taken, so that it's not doesn't cause that type of cancers. So tobacco is very important. Then coming on to the second is the food what we are taking. Usually we say that usually our life has become so much of comfort level, like we are using all the electronic gadgets, and we are not having any exercise, and we are not doing gymming, and we are not walking. So that's very important. We should have at least 30 minutes, what the cardiac guidelines say. We should at least have 30 minutes of exercise, moderate exercise every day, at least 5 days a week, so that we don't have any obesity or unwanted fat levels. So for that, we should have exercise proper. And then the food intake is very much important. We should try to take more and more fruits and vegetables in our diet, instead of having that junk food and all restaurant food. We can have that in 15 days or a month, but we should not take it chronically in a long time. We should take more fruits and vegetables in our daily life, and we should take a lot of water. If we don't have any cardiac or renal problem, then we should take a lot of water in a diet. So healthy diet is advisable in that, and exercise is advisable. Then coming on to the third point, then some skin cancers are caused by the chronic sunlight. Like the some in some countries there is more intensity of the sunlight. So there are ultraviolet rays in that sunlight, so that causes skin cancer. So sunscreens can be used to prevent that skin cancers. Besides that, various chemicals are there in the food. Like we see that the foods usually have subsies and all, they have insecticides and pesticides treated. So that is also so we should try to take more organic farming foods, so that we are not in contact with those insecticides and pesticides. And then radiation also is important, like a lot of like mobiles and all radiation, the radiation level has drastically increased due to the use of these. So we should try to prevent from the radiation, as well as some infections are also important to cause various cancers. Like we say that HIV virus, the AIDS virus, the HBsAg virus, HCV virus, they are found to cause various type of cancers. Like HIV causes lymphomas, may cause leukemias, then Kaposi sarcoma, and a lot of cancers, as well as the HBsAg can cause hepatocellular liver cancer. HCV can also cause liver cancer. And like we know that HBsAg virus usually is caused by transmission from either to the mother to the child, or it may be due to the this contaminated blood taken, like the patients low patients have transfusions, blood transfusions. So if a contaminated needle has been taken, so that can transmit the HBsAg virus. Then improper sexual contact can cause the transmission of the HBsAg virus. So we have prevention in that. So we should prevent from these viruses, like so that can cause also cancers. Various bacteria also can cause various cancers. And then coming on to finishing with the modifiable factors, I'm coming to the non-modifiable factors. Non-modifiable factors comes in first number is the age. Age is very important. Like the age defines the incidence of various cancers. Like in the pediatric age, in the child age, usually the pediatric tumors like Wilms tumor, neuroblastoma, nephroblastoma occurs. In the middle age, the osteosarcoma, wing sarcoma, germ cell tumors of the testis, they can occur. In the old age, usually usually the age group of most of the cancers is old age. Various solid tumors like breast cancer, ovarian cancer usually have a higher age, as well as other blood cancers like CML, CLL, or multiple myeloma. They have in the higher age group. So age is we can't change the age. So age is also a risk factor, like which is causing these cancers. Nowadays, various cancers are happening in the middle age also because of this environment, improper environment. The various cancers which were happening before in the old age, they are happening in the middle age because of the improper environment. What I said, like tobacco and all, whatever the environment is. And the other non-modifiable factor is the genetics. Like the if the mother transmits breast cancer to her daughter, so that is genetics. So we can't change to that. Like if the mother transfers ovarian cancer to her daughter, like or a man has prostate cancer and he transmits to his son the prostate cancer, so that is non-modifiable. So these two are non-modifiable factors. So these are the main, in a nutshell, the mainly the risk factors which cause cancer.
I think that was very informative, sir. Now coming to the diagnosis and staging. So how can one diagnose and stage cancer?
Yeah, in the diagnosing, first, like the patient comes in a OPD, usually first what we do, we take the proper history of the patient. Like what is the, what are the symptoms of the patient? Like in solid tumors, if the like female or male has a breast lump, then we ask the history of the lump. Or a patient has an ulcer in the mouth, suspected head and neck cancer. So we take the history of that. In the cases of blood cancer, like we ask whether the patient has fever, history of fever, or has reddish spots in her body, in his or her body. Then there is a history of some night sweats, or there is a history of weight loss. There is a history of decreased appetite. Or in lung cancer, like lung cancer, there may be a history of coughing, chest pain, then hoarseness of voice may be there, breathing difficulty may be there. Uh, so according to the cancers, the symptoms are the whatever they were the site of the lump, like the lymphomas. They may have lymph node swellings all over the body, in the neck, in the axilla, in the armpits. They may have lymph node swellings. So accordingly, we just inquire about the history proper. What are the symptoms of the patient? Since when the symptoms have developed and how they have progressed. Usually, the malignancies are painless to begin with, painless. So they are mainly painless. So they start with a painless thing, and they finally they increase in size, and finally due to the afterwards they involve the nerves. So they are become painful. So afterwards they become painful. So this is a history. Like we just ask what are the course of the symptoms, and then secondly, what we do, whatever the symptoms are, we examine the patient properly in our OPD. Like we examine the lump, proper breast lump properly. We examine the lymph nodes properly. We examine the patient from head to toe. Like what are the, like in blood cancers, there may be enlargement of the liver. There may be enlargement of the spleen. There may be reddish spots in the body. So accordingly we see the signs, what are the signs in the patient present. So then considering of the symptoms and signs, Then finally, we do needle tests. Needle test, what are the needle tests? Like we do a FNAC simple. We just take the liquid from through a syringe. We take the liquid from the lump, any lump or the lymph nodes. We take it. That is known as the FNAC, fine needle aspiration cytology. And that can also diagnose. And in some, usually in most of the cases, we take the material through a true cut biopsy or a punch biopsy needle. We take this material that is known as a biopsy. So biopsy is taken. So FNAC and biopsy usually confirms what is the cancer. And we can do other tests on the biopsy also to finally confirm like what is the type of that cancer. So we can do immunohistochemistry on that also. Then we have to see, like after confirming that, we have to see the extent of the cancer. Then how much cancer, where is the cancer present, where all the organs it is involving. So we usually do like a chest x-ray in the case of lung cancer. We do a mammography in the form of in the breast cancers. Then we do sonographies. Then we do PET CT scan in which the whole body is scanned. Then MRIs are also done. To see the bone status, we do a bone scan. And various endoscopies are done. Endoscopies are done to see, like in head and neck cancer, laryngoscopy is done to see the larynx. Like, and in the cases of stomach and esophagus cancer, we can do upper G endoscopy to see the cancer. So endoscopies can be done. Then various tumor markers are also helpful in diagnosing. Like in cases of ovarian cancer, CA125, there's a blood test which gets increased. In prostate cancer, serum PSA is there, which gets increased. In colon cancer, serum CEA is there, which gets increased. So that these type of tumor markers, blood tests also help in diagnosing. And then coming on to the blood cancers, what we do is CBC, just a complete blood count, which you do a simple test. That also indicates a lot of malignancies. And then the peripheral smear examination along with the CBC also helps in diagnosing the blood cancers. Besides this, a bone marrow aspiration biopsy is a test which is done in which the blood is taken from the iliac bone. And so the whatever the morphology is seen in the blood bone marrow, as well as the various tests on and above that cancers like immunohistochemistry, flow cytometry, cytogenetics, and molecular typing, they are done on above that. So finally diagnosing the type of the cancer. So this is the diagnosis of the blood cancers. And then coming on to the staging. Staging usually starts from the 0 stage. It's just inside the basement membrane. It is not spread. In the 1, it slightly comes out of the basement membrane. Stage 2, more deeper. Stage 3, it comes. It's a locally advanced thing. Locally advanced means it involves us nearby tissues, as well as it can involve the lymph nodes. So that is a locally advanced stage. This is the 3rd stage. Stage 4, it spreads to the other organs, like from breast cancer, it spreads to the liver, it spreads to the lungs, it spreads to the bones, it spreads to the brain. So that is the disseminated metastatic disease, what we call, that is the stage 4 cancer. So this is the nutshell about the diagnosis and staging of cancers.
That was very well explained, sir, I must say. Now, once the staging and diagnosis has been done, what are the treatment options that are available for different cancers?
Yeah, in treatment, we usually treat cancers by 3 modalities. Like it includes the surgery, radiation, and chemotherapy. So surgery, if we start, surgery usually is done in stage 1 and stage 2 cancers, because those are the early stages, so that the surgeon can get a proper margin after undergoing the surgery. And there is less morbidity after doing the surgery. And it usually the cancer is curable in cases of stage 1 and 2. So stage 1 and 2 surgery is done usually preferably. In those sites where surgery cannot be done, radiation is given. So local treatment is in a form of the surgery and radiation. Then coming on to the third stage usually it's a locally advanced stage. As I said, it is spread to the tissues as well as the lymph nodes. So usually what we do, we usually downstage the tumor. We give chemotherapy. We decrease the size of the tumor, and then we just undergo the surgery to just remove the tumor, and followed by either chemotherapy or radiation according to the what is the HPR in the surgery. So in stage 3, there is a multi-modality treatment usually. And stage 4, usually the disease is spread to other organs. So usually chemotherapy is effective in that. So chemotherapy is one which in which the intravenous, or it may be to intramuscular, or maybe to subcutaneous, or it may be given in the cavity, or it may be given the CSF, intrathecal. So through these various modes, this chemotherapy is given. It goes to the blood, usually to the every tissue of the body. It usually kills the tumor cells in all of the body. So there's a systemic thing. So in stage 4, usually chemotherapy is offered. Besides this, hormonal therapy, immunotherapy can also be given. Hormonal therapy is one which in which drugs are given in those cancers. We usually need hormones to grow. So like breast cancers and the prostate cancers, they need hormones to grow. So hormonal therapy is effective in that, because hormonal therapy that acts against that cancer and usually kills that cancer. So hormonal therapy is effective in those cancers. Immunotherapy can also be used. Immunotherapy now, it's a very upcoming modality nowadays. And immunotherapy, usually what it does, it is use of the drugs in which it improves our immune system to fight against the cancer. Usually it improves the immune system to fight against the cancer. That is immunotherapy. Because in cancer, what it happens is the immunity gets decreased. So immunity gets decreased, so the cancer spreads. It usually works by decreasing the immunity. So if we provide some drugs so which can improve our immunity to fight against the cancer, then the cancer will be killed. So that is the working of the immunotherapy. So in though immunotherapy, hormonal therapy, and chemotherapy, they can be used, as well as some oral targeted agents, which we know as targeted therapy also we use, which act upon proper targets also. So that can also be used in the systemic spread. Usually chemotherapy, as a medical oncologist, I will say that chemotherapy is decided just by seeing, like, in the patient, what is his performance status, how much he's walking, how much he is able to work, how is its ability, how much is the ability of the patient. We see that. We see what are the, like, diabetes, he has a diabetes, hypertension, or other disorders, or then what is the like, how much orally he's taking, how much nutrition he's taking, then how much spread the cancer is there in the body. Just we see the imaging reports and all, how much spread is there. And finally, what is the weight of the patient, and what is the height and weight of the patient. We take the BSA, like body surface area, by taking the height and weight. We take the body surface area. So these are the major factors which we see before deciding a chemotherapy of the patient. And usually chemotherapy can be given, as I said, there are various modes. Then it can be given weekly, 2 weekly, 3 weekly. Then there are various protocols of chemotherapy in which it can be given in 1 day, 2 days, 3 days, or 5 days. Then before starting the chemotherapy, we do some tests before starting the chemotherapy. Like we do a CBC, complete blood count. We do a liver function test, the renal function test. We do the proper imaging. We stage the cancer properly, and then we plan for the chemotherapy. So imaging tests are done. So these are the investigations. Then viral markers are done, like HIV, HBsAg, HCV are done before starting the chemotherapy. Then coming on to the side effects, like if I say that side effects chemotherapy usually causes is it may have vomiting, may have a nauseating sensation, it may have loss of hair, then there may be oral ulcers, there may be diarrhea, there may be fever in a side as a side effect. Then in the long term reproductive ability of the patient can be hampered in the long term. Even chemotherapy, some chemotherapy are found to cause in long term some cancers also, like AML and all, they can cause. Then coming on to the hormonal therapy usually has side effects like loss of libido, then decreased bone mineral densities, bone strength is decreased, then they maybe have joint pains, and then may have uterine bleeding, like tamoxifen causes uterine bleeding. So these are the major side effects of these hormonal therapy. Then immunotherapy may have side effects like it may have infusion reactions, during giving the injection, there may be some allergic reaction. Then this immunotherapy can affect in 5 to 10% of cancers, can affect any organ. It can affect the skin, it can cause dermatitis, it can affect the liver like hepatitis, it can cause the lungs, it can cause pneumonitis, kidney, nephritis. So that's why, etc. These are the main. It can affect any organ, but in the less percentage of cases. What is the usually the oral targeted therapy, like the tyrosine kinase inhibitors, what we use in lung cancer mainly, and in other organs also, like breast cancer also, hormonal therapy we use. The main thing is they have the response rates equivalent with that of the chemotherapy, which we give through the IV, and they have response rates equivalent, as well as they have less side effects, and they are more targeted. Chemotherapy, what it does, it spreads systemically in the whole body. It kills the tumor cells as well as it kills the normal cells also.
Hmm.
So normal cells are killed. That's the cause of the side effects in the chemotherapy. So targeted agents and immunotherapy, they are more targeted. They are much more targeted, and they usually they cause less side effects because they target the target tumor cells only. They usually don't touch the normal cells. So that's the beneficial factor of those agents, that they cause less side effects, causing the equivalent or more response rates in that. So that upcoming the immunotherapy is not a very is a very emerging modality. It's used in a very almost all of the cancers. It has now come as in the guidelines, and usually the cost, as I said, that cost is a very like what whenever the patient or cancer patient he hears about the cost, is very much frightened because of the very much cost, because the cost of oncologic cancer treatment is very much high. But nowadays there are various patient assistance programs also, they have come, so that the patient can be assisted economically. So cost has also now drastically decreased. Besides this, I would like to say that chemotherapy can cause a lot of cancer, can cure a lot of cancers also. Like there's a myth like chemotherapy is usually it comes in the end stage only, it is in the palliative setting only. It can't cure the cancers. Like if the cancer happens, that one has to die only. He can't be cured. I will say that it's a myth. Now the chemotherapy is also curing the cancers also, like in some cancers it's in like leukemias, lymphomas, it can cure the cancer, as well as in the cases of early breast cancer, ovarian cancer, colon cancer, it can cure, choriocarcinoma it can cure, then various testis tumors in the middle aged adults can be cured, various middle aged women having the ovarian cancer like dysgerminoma, that can be cured, and the germ cell tumors can be cured. Then various pediatric tumors that can be cured, like ALL has a very good cure, acute lymphoblastic leukemia happening in the children. That is a very high curability rate. Then various pediatric tumors like nephroblastoma, Wilms tumor, neuroblastoma, they have very good cure rate. So cancers are usually curable.
Right. I think it was once again very well elaborated. I mean, everything right from the treatment plans. Sir, now can you help us understand what is consultative hematology?
Yeah, consultative hematology. Hematology, first, hematology is a branch of medicine which deals with the cause, prognosis, treatment of the blood-related disorders. Usually, the blood-related disorders are studied in hematology, and usually the whatever the personnel, medical personnel, physicians attached to it, they are known as the hematologists. So hematologists, they usually do the consultations in maybe in the serious bleeding disorders like hemophilia or ITP, maybe various hematological malignancies like the acute ALL, AML, CLL, multiple myeloma, myelodysplastic syndromes, and myeloproliferative neoplasm. Then they may do a consultation in the various hemoglobinopathies, like you must have heard about sickle cell anemia, thalassemia. So that is the hemoglobinopathies. Then blood bank associated, whatever the blood groups, whatever the blood donations and all, blood bank associated things, blood bank, so they do the consultation in that. Then finally coming to the bone marrow transplantation and the stem cell transplantation, they also do the consultation in that. So usually the hematology work, the consultation to that is the consultative hematology.
All right, all right. So, sir, once your patients get detected with cancer, how do you motivate them?
Usually, as I said, we usually talk to the patients like we just allow the patient to talk. Like whenever the patient comes to our OPD, we have to listen. We have to have patience in just listening to the patient. Whatever the patient is saying, we have to listen, and we have to encourage the patient. Like we say that I'm together with you. We will get together we will get to all together with we'll get through this problem, and we are all praying for you. And we say that usually you should not need not worry. If it's cancer also, then it's also curable and it's treatable. You can have very less, if you get therapy also, you will have very less side effects or no side effects at all, because a lot of things like targeted therapy have come, immunotherapy have come, which have very less side effects, very good response rates, and they are like approachable also. They have less costs also. Some have very less costs also. So we explain to the patient that treatment is possible, treatment can be covered, and cost has also decreased because of the cost assistance programs. So they need not worry about the financial status. Also, regarding the surgery, also various advancements have come. We explained to them that robotic surgeries, laparoscopic surgeries, they will come. So they have very less, the blood spill is very less, and there were very less morbidity, less hospitalization. So they, and very less pain or morbidity. So we explained to them. Then radiation also techniques, there are various advancements have come, like the IGRT, IMRT, which are more precise, which just kill the tumor cells. They don't kill the normal tissues. They have very less side effects. So we explain all to them that various advancements have come in this therapy also. So need not worry, and just be positive, and just get that, just take the treatment, just finish the treatment and get a proper follow up. And you should encourage the other people of the society also, that the things, the myths about the cancer, they have changed now.
Right, right. So, sir, before we conclude, my last question to you is, how has COVID-19 impacted the treatment of cancer?
Yeah, regarding as we see that COVID-19, the second wave will also come, and third wave is likely to come. So usually, what we aim at is, usually we aim at the curable patients. Whatever the curable patients, they are coming to the OPD. We usually, as a medical oncologist, we offer full dose chemotherapy to them, so that they are cured properly. There is no residual disease, or the recurrence chances decrease. While in cases of the cancers which are spread, which are totally spread, and there we have a palliative intent only, we usually work on how to improve their quality of life and how to decrease their side effects and all. So we usually give, like, instead of giving 3 days or 4 days chemotherapy, just to decrease the patient coming to the hospital back and back, or to the center back and back, so that he has a chance of getting the COVID infection, just to decrease the chances of patient coming to that, we usually offer, like, we, instead of giving 3 days or 4 days, we give 1 day chemotherapy. Then we usually give various prophylactic medications, so that there are no complications in between the chemotherapy, like the vomiting is less, so we give proper antiemetics or extra antiemetics to the patient. We give, like, after the chemotherapy, the TLC count decreases. That can, if the TLC count decreases, then the patient can have a fever, so that the patient have to have come to the hospital. And after getting the TLC count decrease, he may have various infections also. For that, he has to get admitted in the hospital. So then the chances of COVID getting COVID will increase if he comes to that. So we usually give prophylactic GCSF filgrastim and pegfilgrastim to the patients, so that the chances of coming to the hospital in between the chemotherapy, they are decreased. Then in the OPD also, we usually follow all the measures, like we wear a face mask, then we face shield, we wear gloves, we sanitize our hands, we have a proper social distancing. Then the staff also, which is offering, who is offering the chemotherapy, is advised to follow all these measures. Then whatever the flu patients and the fever patients, they are coming in the emergency, usually we just take a proper history, and usually the doctor usually takes the history of any contact with any COVID person, or any has in travel history of any place which has a in history of, like. So we usually like segregate or screen those patients, and usually send the patients for the COVID testing. And if they come positive, they are totally referred to the COVID center. So usually we segregate and then send to the usually we screen those patients. So that is all, how we are modifying. And regarding the COVID vaccine, I will just say that COVID vaccine has to be taken. Whatever cancer is there, we should not avoid that cancer vaccine. We should we should take that COVID vaccine, all the 2 doses as prescribed by the guidelines. And in cases of the patients taking chemotherapy who have a less TLC count, they can just wait for 2 to 3 days or 5 days just to get the counts improved, so that their immunity improves. If their count is normal, then the immunity will be normal. So then they can take this vaccine. So in cases of bone marrow transplant and highly myelosuppressive chemotherapies the patients are taking, we should just wait for the counts to recover, and then they can be taken. In the bone marrow transplant also, we should just if the patient has undergone bone marrow transplant, then also we have to wait for some time to get the vaccine. So in those cases also, 2 to 3 possibilities also, we have to wait for COVID vaccine. Otherwise, we can totally take the COVID vaccine. There is no contraindication.
All right. So this session was really very informative, sir. Thank you so much for explaining everything so well. And once again, thank you for taking time out and joining us today.
Thank you so much.
Thank you so much, sir. It was a pleasure having you with us.
Most welcome.